Our next student is Laxmi Thileepan, and she's a third year University College London medical student who took on the huge topic of psychosocial impact of the diagnosis of Marfan syndrome on the whole family. And she used her skills in administering questionnaires, so we're hoping to hear some results. Certainly her work will form an academic paper to be published, as well as helping us to understand the dynamics of the Marfan syndrome families.
Hi, my name is Laxmi Thileepan, and I'm going to be talking through the psychological aspects of Marfan syndrome, especially on families. So I'm excited to share this topic. So particularly over summer, this has actually become quite a genuine passion of mine. The responses I got for the questionnaire didn't only just touch me, but it played a massive role in shaping my research. So as we go through the presentation, I think it's important to acknowledge that the well-being of parents and family members is often overlooked when discussing medical conditions such as Marfan syndrome. But I believe that everyone's mental health is extremely important and deserves our utmost attention and care. So throughout my presentation, we'll go through the impact on families, also coping strategies and the resources available. So I hope that you find my presentation informative, but also empowering as well. So certainly as a parent, there are quite a lot of challenges beyond like the usual demands of like picking out school uniform and managing daily life. There exists an additional layer of stress, an array of responsibilities that extend beyond the conventional parenting role. This additional burden encompasses the role of a patient advocate, an educator, scheduling appointments, coordinating referrals, all while ensuring your child receives the necessary medical procedures and care. This added stress can indeed take a toll on the family, and its impacts are far-reaching. It affects not only the logistical aspects of daily life, but also the emotional and physical, psychological well-being of both parents and children. So it's quite imperative that we acknowledge this as a challenge, first of all, just so that we can understand the implications it can have and how to kind of reduce stress. So the way I structured my project was I first began formulating a research question, and then I conducted a thorough review of like recent articles from the last 5 years from like reputable sources. So I used a criteria used to kind of like see which research is important or not, which is known as a CASP criteria. I critically analysed these sources and found ones that are relevant to my own to my research question. I then was able to make a pamphlet. This was for patients, but also for healthcare providers, just to kind of signpost what resources are available. And then I designed a questionnaire, which was sent out to families within the Marfan Trust. So when conducting my research, I encountered that this topic is actually quite complex. So to provide a structure and depth to my research, I adapted the framework of the Psychosocial model. So this model was first conceptualized in 1977 and has been a valuable tool in understanding how these factors kind of influence the well-being of individuals and also their family. So the model kind of focuses on 3 factors: biological, psychological, and social, and the interconnections between them. And this kind of provides a holistic approach in healthcare. So not just kind of looking at a patient and only looking at their disease, but looking at their overall well-being and how maybe if they've got a lens dislocation or they have to wear heavy glasses, how would that kind of impact their daily lives? So in instances where healthcare providers effectively incorporate these principles, it's very useful, and it can help a patient it helps make sure that the patient is at the center of the treatment plan. So the biological factors mainly focus on like physical manifestations of the disease, such as characteristics of the disease, and it also covers medical treatments and interventions. We also have psychological factors. So most of my talk mainly focuses on the psychological factors, as different aspects of the disease can have profound impacts on our mental health, especially when living with a chronic condition such as Marfan syndrome. So first, we'll look at the psychological impact on patients. So Marfan syndrome extends beyond its physical manifestations. It brings forth significant emotional and psychological challenges for those who have it. And these challenges encompass various aspects. You can have body image concerns. Individuals with Marfan syndrome often have distinct physical features, and this can give rise to potentially impacting their self-esteem and overall confidence. And during my questionnaire, I found that many parents have realized that their children do struggle with this. There's also chronic pain and fatigue. So the syndrome's musculoskeletal and joint-related issues are frequently can frequently cause chronic pain, and coping with the daily discomfort can take a massive toll on the well-being of the patient, both physically and mentally. So it can be quite exhausting. Patients can feel anxiety and depression due to their uncertainty and vulnerability. And the presence of anxiety and depression in individuals underscores the necessity for a holistic approach to care, and not only addresses the physical aspects, but also healthcare providers should think about providing an emotional support as well. There's also a psychological impact on families. The emotional and psychological impact of the family unit is very important, as for the patient, usually family is their main support system. So it's important that the whole family together kind of works through this. There can be financial stress. So the burden of medical expenses, surgeries, and ongoing healthcare needs for a family member with Marfan syndrome can place a considerable strain on the family finances, and this can cause anxiety and tension within the family unit. There can also be social isolation. So the demands of caring for a loved one with Marfan syndrome can be all-consuming, leading families to feel isolated from their circles, and the isolation can cause feelings of loneliness and frustration. There's also concerns about the future. Uncertainty often looms large in the minds of family members as they ponder the long-term health and the well-being of their loved ones with Marfan syndrome. This constant uncertainty can take a toll on their emotional well-being and cause distress and apprehension about what lies ahead. The caregiver may feel burnout. So family members who take on caregiving roles may find themselves at risk of experiencing burnout after the relentless demands of providing care, which can exert heavy tolls on their mental health and overall well-being. Guilt and blame. It's not uncommon for parents to feel guilt. And during my research, I found that blame and guilt were the two main emotions parents felt during the early stages of diagnosis. So blame in this context tends to be intrinsically self-reflective, manifesting as an inclination to assign responsibility or fault to oneself. This intricate psychological response typically arises during moments of profound distress, such as receiving a Marfan's diagnosis. In families where Marfan syndrome results from a spontaneous mutation, parents might find themselves navigating a path of self-doubt and self-criticism. This may lead to a relentless questioning of every decision they've ever made throughout their journey, such as contemplating whether they took the right vitamins during pregnancy, or if their actions somehow contributed to their condition. However, it is crucial to emphasize that Marfan syndrome's emergence from a spontaneous mutation means that parents' actions has no direct influence on its occurrence, and it's vital to comprehend and internalize this point to understand that there isn't much use on blaming yourself or blaming others. And persistent self-blame can create a massive toll on your own mental health. It can intensify stress, it can cause anxiety, and in some cases precipitate feelings of depression. So it's important to kind of understand the way you feel to help manage these emotions. and cope effectively. Guilt is also another key emotion that's felt by parents. So it's a very complex and pervasive emotion. It encompasses, both cognitive and emotional aspects. And parental guilt often stems from perceived responsibilities or passing on genetic mutation that causes Marfan syndrome to their children. And it might also arise due to feelings of powerlessness in the face of their child's health challenges. So we're on to the last factor, which is social factors. So peer interactions. So with families where this is a spontaneous mutation and they may not know anyone with Marfan syndrome, it can be quite difficult navigating this time, as you may feel very isolated. You may see that there's no one around you who's ever even heard of this condition. So it's important to kind of reach out to your friends or to your extended family or any family members, just to kind of maybe educate them on what this is, just so that you don't feel isolated. There may also be tension in romantic relationships, as this is a difficult diagnosis, and there may be elements of blame. So it's important to kind of try and work on these and like understand why you may feel this way. And if we look at school and workplace, so sometimes when you're enrolling your child into school, the school teachers may not be fully aware on the best ways to support your child. So there is an element of being your child's advocate. So what you could do is kind of talk to the school about ways to support your child, or what activities they should be included in, and what activities the teacher may be careful about. So like in PE, it's quite good to encourage your child to get involved with any activities, but like physical sports. So if they're going to play rugby, maybe for that one, you could work with a teacher to try and find a way to make it less, to make it more acceptable for your, not acceptable, sorry, more adaptable for your child. So if we go on to how to deal with these emotions, so dealing with feelings of blame and guilt, the main way is through one resource you could use is psychotherapy. So this could be exploring how you feel about the diagnosis and why you feel that you are to blame. Psychoeducation is also important. So understanding the genetic basis of Marfan syndrome can provide reassurance and dispel unfounded guilt. And it's also important to encourage self-compassion and self-forgiveness, as it can help navigate blame constructively. And focus on what you can control. So concentrate on providing the best care to support your child and channel your energy into taking proactive steps. So the support that is available, so there's many valuable resources which can help cope with the struggles that come with looking after your child. So if we look at the psychosocial support, you could reach out to your local psychological support service, maybe thinking about therapy or family therapy, which facilitates open communication and also fosters a positive environment to talk about your feelings. There's also educational support services. So there's resources online which can help find activities that are adapted for children with Marfan syndrome. The Marfan Trust is a great way, as it offers comprehensive support to families through the helpline and advocating for your child, as they may not always be able to do this themselves in certain situations. Reading peer-reviewed publications can be helpful for parents and healthcare professionals to learn about what the latest medical research is. So during my study, I found, so this was an internal questionnaire conducted within the Marfan Trust. I received 108 responses, and the key finding that I found was that the resources available weren't utilised. So strikingly, around 62.8% of participants had not tapped into the valuable support offered by charities, and also 57.5% hadn't used any support groups. But from those who did use support groups, their experiences provided showed that it was quite important for them, as it helped them sustain a good mental health, provided practical insights and strategies, and fostered a sense of belonging within the Marfan Trust. So I think our next steps should be keep raising awareness, like these information days, and also awareness within your own extended family or just friends, support one another, and also signpost resources. So I was able to make these pamphlets which kind of give more detail on the impacts on families, but also the resources available. And you can find that on these QR codes. So thank you for listening.
Laxmi, thank you very, very much. And it's nice to hear the results of your questionnaire, because that was over and above the duty of call on this project, but very valuable. Thank you very much. Are there any questions for Laxmi about the impact on your families? I do find that doctors are much more aware about Marfan syndrome than they used to be. I had one patient who went in trepidation. She moved and she went to her new GP, and I always suggest taking one of our pamphlets along. You know, I said the doctor won't read it while you're there, but he'll read it after you've left. And she went armed with her pamphlet and sat trembling. And she said, I thought you should know, as a new patient, I have Marfan syndrome. And he didn't even look up from his writing. He said, oh, yes. How are you affected? Eyes, heart, skeleton? And she nearly fell off the chair. So I think all our webinars and pamphlets and newsletters are indeed having an effect. But as Eleanor Hyde, one of our trustees, stresses, every patient has to teach wherever they go. They have to say, look at my hands, you know, look at my fingers, look at my palate. Often patients are asked to take part in an exam for medical students. And once students learn about Marfan syndrome, they don't forget. So I think all our work to raise awareness through pamphlets, such as the one that you're writing.
Dr. Charles, can I make a quick comment?
Yes, Deva.
So it's Dr. Naqvi here from the Royal Brompton Hospital. Both excellent talks, and I very much enjoyed that, Laxmi. And I do hope you come. I'm inviting you to come and attend one of the Marfan clinics with me. I would very much enjoy that. How would you advise me to reach out to help parents? Because I've learned a lot from your work, and I hadn't really given much thought into the fact that there's so much guilt with parents, because obviously I'm very much focused on the aorta and the mitral valve and the cardiac issues. But what do you think I could offer the parents in terms of support? What would you suggest?
I think reassuring them, like asking them how they feel as well, and then maybe kind of reassuring them that like it's quite normal. I think it is normal to feel guilt and like maybe blame or anxiety, definitely. So I think if you feel like what you're feeling is normal, you're more likely to go out and look for ways to kind of help. And sometimes, like if you're a bit stressed, it can kind of lead to like maybe you having arguments because there's increased tension at home. So kind of understanding the reason why you're acting like this, and then like just I think directing them to the resources available. So there is like family therapy, so you're talking with your partner, and maybe if you've got some older children, with them as well, kind of discussing how this diagnosis will affect you as a family. And then also like just signposting charities. I think within charities there's quite a lot of support groups, and I think talking to different parents can kind of help you understand like different ways on kind of helping your mental health, and it kind of gives you a sort of like hope as well, if that makes sense.
Okay, so I'll make sure I'll bring it up so that they know they're heard, and then I always certainly signpost everyone to the fantastic Marfan Trust. Thank you very much for your talk.
I think Mariam's hand was raised. Mariam in the audience.
Thank you for your research. I really appreciated that, because I think for most parents who do have Marfans in the family, it's a real challenge and a real struggle initially, especially when the understanding of this chronic condition has been real struggle to explain to every medical professional team who had no idea what Marfan syndrome was. And if your child is ill and you're constantly trying to find help for them, as well as trying to explain yourself, it's a real challenge. Sometimes it gets very tiring, and after a certain point, it really wears you down, and it does really affect the carers to feel as though you're part of society, functioning part member of the society, and it is very isolating at times. I mean, my question here really is about how can we get families to, like, say, communicate, have more open communication, like have family therapies? Because I think for many, say, families from, say, some Indian backgrounds or that kind of background, it's quite a challenge for them to seek therapy, family therapy, to have these discussions. So how would you recommend families to have that, build that bridge because there is a lot of guilt, there is a lot of blame, and it just causes additional stress upon the family and upon the patient as well. Thank you.
So I think with that, I think it's it's kind of educating yourself. So maybe if you realize that maybe the way you're acting is due to like guilt or blame, kind of understanding why do you feel guilty, or why like maybe someone else blaming you, because I think that comes with like education of like what the syndrome is and how the syndrome is caused. And then I think going to family therapy, I think before you like reach out to family therapy, it's important to kind of be open within like yourself and be wanting to kind of make a difference. Because I think within therapy, it's like if you're not willing to speak, it's quite difficult and you may not find it as useful. But if you go within like an open mind and you want the best out of it, it's much easier to kind of be open and talk with each other, but also like have their therapist there to kind of guide the conversation. But yeah, does that?
It'd be best to go through your child's pediatrician, wherever that may be, because they probably know what the local facilities are. And may I make a plea not to leave out the grandparents? They're very important. They can support as long as they understand, but quite often they're left on the fringe and they have no idea what their grandchild has until somebody explains it to them. And they worry about further grandchildren and, what they should do to help. So don't forget to include the grandparents.
Maybe that's an idea for another leaflet for us, Anne, a leaflet for grandparents.
All right, we can do that. Victoria, can you make a record?
Yes, I've just done so, actually, diligently.
Here's another research project for us.